You're on mute. FaceTime, or I can get my other laptop and join that way. What's your preference? I can get my laptop and I can sign in another way with another, so I'll have two signed in at the same time. Okay. Samantha, it says on the top that it says live on Facebook. Does that mean we're really on now?
We're ready now, yeah. So we can go ahead and get started. I'm gonna go away.
Okay. Yeah, for the interpreters are having just a hint of a problem right now, Samantha. Hold on just one moment. Yeah, are you ready, Denise? Susan's asking. You are still muted. Samantha, Susan says, okay, we got everything set up otherwise, but now we just need to get the interpreter set up. So just give us a second.
What exactly is the problem with the screen?
The interpreters are trying to see each other.
Oh, see each other, okay.
Denise, it keeps bouncing every time I call you. It just stops. Okay. Yeah, let's go ahead. I'll figure it out. Tell Susan to go ahead and go. I have FaceTime. I keep trying to call you and it bounces back. Okay, so you go ahead, turn off, I will start, and you work on FaceTime. Tell Susan that. Okay, I think we're gonna go ahead and start. Hello, everyone, welcome. We're so glad that you're joining us here tonight for our Deaf Health Talk. We have two awesome speakers who will be introduced soon. Prior to that, I want to give you a description about my background. My name is Susan. I have a black shirt with some decorations down the side on the arms. I have a gray background. Welcome to the Deaf Health Talks. We have these every month. We have a variety of topics that we do. Tonight's topic is mental health in the community. The Deaf Health Talks have been made possible by several people being involved and several organizations being involved. So the Deaf Health Talks are the University of Michigan Family Medicine, Michigan Deaf Association, Partners in Deaf Health, PDH in Rochester, New York, Michigan Deaf Health, and Michigan Medical Interpreting Services. So thank you to each of those for providing services and help for us today. Mental health is such an important issue, and it's a very tough conversation to have sometimes. Sometimes it feels embarrassing. Sometimes it's something that we feel like we need to hide. And some people are very open about talking about it. We have a variety of ways that we deal with it. We have two experts with us tonight, Leanne Valentine. Leanne is in Rochester and works at the Deaf Wellness Center. She is a family therapist. And then Donna Gordino is a PhD. She graduated from Gallaudet in 2018, and she works one-on-one with deaf individuals, adults at the Deaf Wellness Center. I will let them explain more about themselves if they'd like, but we'll go ahead and start. So if you would just give us a little bit about your background, and then Donna, if you start, then we'll have Leanne go next. Sure, great. My name is Donna Gordino. I am deaf. I work in Rochester, New York at the Deaf Wellness Center. I'm a clinical psychologist licensed in New York State. I provide therapy to groups and one-on-one counseling. Great, thank you, Leanne. My name is Leanne Valentine. My name sign is Leanne up in the corner. I also work at the Deaf Wellness Center as a family therapist. I also work one-on-one. I work with groups, a variety of settings, and been doing that for a while. Oh, and I forgot to introduce myself. My name is Susan Demers McLetchie. I'm the moderator for this evening. We will have captioning as well on the Facebook Live, so you'll be able to use the captioning. If you cannot see the captioning, it should have been worked out and everything should be fine now. So once a month, we have Zoom meetings on Facebook Live. If you are interested in subscribing to our monthly meetings to know what's going on, you can sign up. We can put your name into MailChimp, and we will make sure that you have the information for future meetings and future events ongoing. So awesome. So Donna, would you like to talk about your work within the mental health within the deaf community? Give us a little bit of information that you have, and then we'll move it over to Leanne, and then we'll have question and answer. Any questions we can type into the chat, and then we will make sure you can type them in right now, even before the end, and we'll be ready and be able to bring those questions up later. So I work with a lot of individuals who believe that there is a stigma in understanding mental illness and mental health. And they think, oh, I don't want to take medicine because that means there's something wrong with me. Or they've been told there's something wrong with them. And that really impacts their therapeutic process. With mental health, we know that we need to break that stigma. We need to get rid of that. So a stigma, when I talk about that, specifically what I mean by that is it's a public stigma, meaning that people who are known to have mental health or other diseases, they're looked down upon. People look at them and they say, oh, they're crazy, or they're mentally ill, they're going to use all my time, or they're a danger to society, they're going to hurt someone, they're very explosive. All of those stigmas are things that people believe. You know, people talk about the weather in Rochester, that it goes up and down and up and down. You know, oh, the weather is bipolar. And even though they're not talking about bipolar as a person, they're still talking about bipolar as a stigma, saying that, oh, it's very up and down. It's a very negative attitude that is looked upon with mental health and mental illness. So those kind of stigmas are the public stigmas, but they're also self-stigmas that I think that something's wrong with me. I'm not normal. I'm crazy. I'm weird. You know, and people feel a lot of shame from that, or a lot of embarrassment, you know, and if I can get help, no, I can't do that. I don't want to do that. I will be fine. You know, other people go to counseling. I don't want to go to counseling. So understanding mental health, there's a lot of struggles to be able to accept and know that therapy will help and therapy will make a difference. But it's really a hard time getting in there and getting moving with therapy and getting it started. So when we're talking about stigma, we try and think, okay, so how does that happen? Where did all of that start? And there's not a lot of information about how the brain works. You know, there's a lot of information about how people think about stigmatizing people who have mental illness, you know, and there are a lot of things that they've heard about from their on the radio, on family, friends, someone else. You know, if you go to a food store and you stand in line and you're waiting and you're talking about, oh, I go to counseling or I do that, or someone would say, you know, when someone looks at that, they think that, oh, is this person normal? Do, you know, is this what's wrong with them that they go to counseling? You know, or they look at them as okay, but then they get access to those communication, they get access to those services, and people are understanding. But with the deaf community, we don't have those conversations. We don't understand that having counseling is something we can do. We've all grown up with the dinner table syndrome, where there's so much going on around us that we don't know what's happening within our family. And being able to have access to the communication to talk about mental health, to talk about disorders, to be able to talk about that information. The deaf individuals don't get access to that information. And because of that, what we end up relying on is media, on TV, on newspapers, on magazines. And the media, when you are talking about the media, 60, 70% of the mental health information that's learned from the media is concerning, because it reflects what people believe mental illness is or mental health is, and it's not. People who have mental illness may see a movie on schizophrenia, and if someone has seen a movie that a person is schizophrenic and they're dangerous and they need to be careful, you need to be careful with them, or that a person is violent or they're suicidal, or all of the things that these media information shows you, or even depression. When you talk about depression, people will see in media that, oh, someone's depressed means that they have suicidal thoughts. It means that they're thinking they're going to kill themselves. And that's not what depression means. There are many, many other ways and other symptoms that depression is shown. So when you're talking about things, you can't think, oh, that's just the media showed us exactly what it is. No, there are many, many other things. There are movies that show people going into an asylum, and they're all crazy, and the psychologists are very cold and very mean, and not someone that is being helped. So all of that representation from the media is making it so people are not understanding what happens. Sometimes the media says, oh, you can go to counseling 2-3 times, everything's fine and it's great. But that's not true either. Counseling takes a lot of time of working on yourself and working with yourself to be able to have that access. And the information that we're seeing on the news, that we're seeing on the media, that we're seeing in movies and TV, it has developed us to a point that we think that we should be ashamed if someone has a mental illness or a disorder, or we should think that the media is showing everything. So really, we need to understand that we can't rely on the information that we get, especially now talking about social media. It doesn't reflect everyday life for people. It's not a reflection of who we are today. It's not a reflection of the individual. You know, sometimes people post things on Facebook and they show these pictures where things are happy and things are going on and it's great. But what has happened prior to that? What happens in the other times? Facebook does not reflect their whole life or what their life is happening. You know, maybe 10% of their life is being shown on Facebook, but there's a 90% that they're hiding, that we're not seeing, they're not portraying. You know, everything looks great. Oh my gosh, this person gets to travel and they get to go other way and they get to this, and it's an illusion. Because when we think about this, we think, well, they have everything and I'm not. I have a fear that I can't do this, you know, or if I share my stories, if I share my experiences, I can't tell people that. I really can't do that. So what we need to do is figure out how we can talk to people and make sure that we are having doctor's appointments and we're having individuals that are able to have access to those and to be able to know exactly what's going on. And we need to educate the public so that they understand what it means when you say mental illness or mental health. It's the same as if I go to a doctor for just a wellness visit, or I have a pain, or I have something else that is a physical condition that I need to go to the doctor for. Counseling is the same way. You go to a provider, you work on what needs to be done, and then you take care of it. And that is something that we need to understand with mental health. You know, it could occur because someone's depressed, they've lost their job, they're upset, they're having a bad life at this point. So going to see a counselor mean that, oh, you need to go forever and you're going to for the rest of your life going to a counselor. No, sometimes it is just a very short time that's a situational to get you through what you're experiencing at that time. So there's the ability to go to a counselor, be able to get back to your mental health, the same as you go to a doctor and you get back to your own physical health. So we need to remember that. He's freezing. Yes. So the same way that you have figure out how to make yourself better physically, you have to figure out how to make yourself better mentally. And that's by going to those providers. That's what you're doing. You know, and there are good and bad things that can be done. You can take care of things, but your life is important. You know, the priority for you is to know. Go, James.
Friends and relatives, of course, you know, that way you'll feel some commonality with other people. That helps you know you're not alone when you're struggling with things. So being open is a first step to sharing those feelings. And it's interesting that we can stigmatize people with mental health problems, but if we talk about it more honestly, we realize that a lot of us are going through lots of different things. You know, it's funny when you can't decide what to wear in the morning, whether it's going to rain or not. It's not just because you're indecisive, it's not being bipolar. And so sometimes conversations with loved ones can help you understand the difference between, you know, what is going on in your life that is actually something that you need mental health counseling for, and what is a normal, it can humanize the normal things that we go through, you know, to help you know we're all normal, we're all going through different things in our lives. Everyone's going through their own issues, especially now. Everyone is going through different things. But if we hold it back, that helps us continue to believe that what we're going through is very unique and much more problematic. And that begins the downward spiral to making it even harder if you do get mental health support later to climb out of that depression or whatever you're going through. So the minute you start to see a decline in how you're feeling and experiencing the world, if you can grab it by talking to people in your life, by seeking some mental health support, you won't crash in the same way, and you'll be able to, someone will be able to throw you a line, so to speak, have that support. So I just want people to know that what we're going through is okay.
I think it's a good reminder to the community when we're talking about the Rochester weather as bipolar. That's something that we need to think about, because there's a stigma behind that. I think that's a very good reminder to us. So bipolar, the appropriate sign for bipolar now, we've seen bipolar, and what are we signing at this point?
Yeah, you'll see some people spell it. You'll see some people use the sign for bipolar that you just used. I've seen both, and I think right now they're both considered appropriate.
I've seen some questions in the chat. I think what we'll do is go over to Leanne. And Leanne, if you want to say a few words, go right ahead.
Sure. So, I've been watching the news. I've been keeping abreast of current events. We're seeing what's going on, and it's a lot of heavy information. Black Lives Matter is a very, very important thing in the forefront of our world right now. And you're seeing a lot of police, death by police negligence. You're seeing George Floyd. You're seeing people being physically held to the ground, knees on necks. We're seeing more and more increasing police violence against innocent people. And it does increase fear in the community, especially with people who consider themselves racial identity. They call themselves Black, Hispanic. It does. People of color in general are affected more about these current events because it hits home for us. And it's not just causing fear, it's causing anxiety, it's causing depression, it's causing heightened levels of stress, of concern about the future. As a Black deaf woman, in the past, I didn't experience these kinds of racial injustices from police, but now if I see a police officer drive by, perhaps it heightens my concern more than it was already an issue before because of something in the news. And that's an experience that many people of color are happening. It's not just one person of color who's been wrongfully killed by the police. It's many of us. And so we're seeing there's sometimes so many reasons that our mental health is heightened or agitated. There are things that in the past may not have frightened you that now are causing higher levels of stress because things
A
are
white
heightened.
person calling the police on a Black person.
Yes, so fear, anxiety, all of these emotions that people of color have experienced are now even more heightened. It's unfortunate, and it does in fact affect everyone's mental health. And the question is, what do we do about it? How do we support each other? What can we do to help the situation? How can we have these important conversations and not hold on those feelings that we've held back for so long? How can we talk about it? How can we have an open dialogue? Not just with your families, Black American families having conversations about this. They've talked openly about this for a long time. But what I'm really talking about is, I've got some freezing.
Talking to other people, other individuals. People believe that religion is a help, and if it is, praying, talking to God. But your mental health may not go away just because you're praying to God. It's not easy to talk about. It's been taboo for so many years in so many families, in Hispanic culture and other cultures, that this is not something you talk about. You don't air your dirty laundry. That's not something that you tell people. So if there's a mental health issue, people are going to mock you. They're going to look down on you. So no, that is not what we should be doing right now. If something horrible has happened to a person and they've been traumatized by it, it will increase their experiences of conditions such as PTSD, post-traumatic stress disorder. They may turn to other vices, drugs, alcohol, an increased violence, increased abuse, physical, verbal, mental abuse, even sexual abuse. So when we're talking about a violence that is continuing and it's leading to death, leading to arrest, what are we doing to help these individuals? It's very, very tough. It's very difficult. People are resistant to acknowledging mental illness and mental health. Mental health counselors, for a very long time within the system, have been white. So for an individual, a BIPOC person, to be able to think that, oh, I'm going to visit with this white individual who understands me and my quality of life is going to improve. That's not something that we would feel comfortable talking with someone about that. If a Black person decides that they need help and they sit down with a white counselor or a therapist, culturally, is there an understanding? There's a very big difference in the cultures. It makes individuals even more nervous. How am I going to be able to tell you something that I'm not sure you would understand? There's not a trust there that I can develop. And the problem's not going to go away. And often what happens is many individuals are poor. They think, oh, if I go to counseling, I can't afford that. That's way too expensive. I can't go to counseling. You know, I can talk to my pastor at church, that it's free. I don't have to pay a minister. So I can go and talk to the church chaplain. But a mental health counselor, oh, no, way too expensive. I cannot afford to do that. And at the end, they're suffering even more. And maybe they're not even understanding their insurance, or even if they have insurance, they don't know how to get it if they don't. So having access to the internet is another thing that could be a barrier to them. So again, not having insurance, all of those issues, all of those are things that we need to understand that they're experiencing. Deaf or hearing, it doesn't matter. Those individuals experience that. If we're talking about individuals who have a 5th to 8th grade level reading throughout the United States, it's very difficult for individuals to understand, how do I work my way through this system? How do I get insurance? How do I find someone? There are so many different types of insurance in the United States. And then to have to pick one, and mental health counseling is not cheap. It can be expensive, yes, but there are counselors that work on a sliding scale. Some offer financial assistance for the counseling, which is very nice. But how do people know that? Where are we getting our information from? We don't have that information. And so again, people are thinking, oh, I can't go, it's way too expensive. A second issue, a second big problem is transportation. Those of us who have a car, we know cars are expensive. You know, it's a luxury to have a car, to be able to drive one and have one, you know, for my own security to be able to do that. But think about individuals who have to use public transportation, the bus, even calling a taxi if they could afford it. Most of the time, these individuals are using public transportation. And they don't want to stand out in the hot sun as it's beating down on them, waiting for the bus to come. No one wants to stand in the cold with the wind blowing and the ice and everything to be able to get to their mental health appointment. That's not me. You know, I'm not going to stand in the sun. I'm not going to stand in the wind and the rain. You know, I have a car that I drive. I have air conditioning. I'm safe inside my car. So that's not fair. It's not even an even playing field for everyone. Sometimes we're talking about individuals who live very far out, not in the urban area, very rural. How do they get from their rural home to the counselor? And there's going to be a lot of cost to that. If we're talking about having to pay a taxi, we're talking about having to pay anything that's going on, and then have to pay the counselor for the 45-minute session. The expense is there. There are not a lot of Black BIPOC counselors out there. The counselors that are out there, to be able to understand the cultures and the experiences of a BIPOC person are very few. And that means that the comfort level is not there. So if we're talking about a Black woman and a counselor, they may be there, but where are the resources? Where is that listed so I can find them? That isn't listed anywhere. So if a person of color wants to speak to someone, they, one, may have to be figuring out a hearing person, and then they're going to type it in, they're going to see all of these names, but we don't know if they're deaf or hearing, we don't know their racial identity. So struggling just to try and find someone that has empathy for me, understands my needs and my culture. It's even harder for women. A lot of Black women go through anxiety, especially when it comes to raising their children, with family situations. They suffer depression. They don't know how to do what's going to happen. And now talking about Black Lives Matter, how do I protect my children from them being the victim of something like that? So there's so much that Black women are struggling with to be able to understand and to be able to get through, and just to be able to find that one mental health counselor that is qualified to help improve my quality of life is a struggle that most women are going through.
So really for us as Black women in the POC BIPOC community to work together to find these resources, you know, we're open to supporting each other. We understand, you know, what your needs are. And also if we can't find what you need, we'll find something that suits to meet your needs if it's not your first choice, because we have resources here, we have funding, we have support available. What is most important really is to think about your mental health rather than suffering. So please, we're encouraging people to ask for help. It's a humongous barrier right now in the BIPOC community of really people knowing there is not only a stigma in the BIPOC community, but most especially in the deaf Black community, or even the hearing Black community. There is extra stigma about mental health, and it's very strong. It's ironic, but in this community, you know, there's this sense, oh, people say, oh, they believe in voodoo and Black magic, but it's interesting that we have evidence what's happening in real life, you know, or that the BIPOC community feels that voodoo has evidence, that it shows that it comes through. But it's interesting that that community is also very suspect of the mental health community because they have not always been, they've been wrong sometimes. They haven't always had the resources they needed.
Within the BIPOC community, there are so many challenges. There are so many things that have happened so far and people are experiencing. And when we're talking about a pandemic, even making it worse. And when we're talking about mental health, it is very difficult. So thank you so much. We have questions. How do we deal with the stigma related to being hard of hearing? We've noticed there's a lot of negative impact on my mental health because there's not a lot of people in the community that I can speak to about this. So that's a challenge. So being hard of hearing is a stigma in and of itself. Donna or Leanne, do you want to answer that? You just need to talk louder.
Okay.
So any identities that are not obvious from first sight, you know, for instance, there's a question about being hard of hearing and feeling like perhaps you have some residual hearing. You may be able to use your voice. You may choose to use your voice. So you kind of fit in the deaf community, but you may also sign, but you may be perceived by the deaf community as not signing in the kind of fluency that deaf people recognize as part of the culture, or be seen as someone who does use their voice, so feels not completely accepted. And so this concept of feeling that you're working harder to connect with both the deaf community and the hearing communities, almost being stigmatized as not deaf enough. So yes, that is a hard thing that people experience. And I think something that people can do, really, it very much depends on your sense of where you feel most comfortable. Perhaps, you know, you need to work harder with hearing people and your sense of identity, or perhaps, you know, the deaf community perceives you as not deaf enough. But maybe being okay with that, maybe understanding where you feel most comfortable is where you feel the right place for you. But the important thing is to find a community, ideally of hard of hearing people who have those same struggles, but to feel belonging somewhere. So you may not feel equally accepted in the hearing or deaf communities, but to have a sense of belonging.
Right. The feeling of not fitting into the hearing world and not fitting into the deaf world. Yes, that is something that I'm sure people have experienced. We have another question. How do we find free counseling services? How do we find a BIPOC counselor? So, either of you?
Yeah, honestly, I really don't know of any free counseling available, free counseling services or organization. Most counselors do require payment. Um, there's many reasons for this. I think in terms of specifically locating BIPOC counselors, it's not an easy question to be answered. To be honest, most counselors are participating with a variety of different groups, depending on their state, depending on their community. It's difficult to find us. My suggestion would just to use Google, and then hopefully you can find someone that matches your specific personal needs and preferences, that matches something that you're looking for, what you want. It's also okay to ask your doctor, ask your PCP, your primary care provider, hey, can you help coordinate? Can you help lead me to a counselor of this type? Also, you can ask the welfare office. I know it sounds awful, but ironically enough, they do have lists of providers. They do have places that, you know, they may have BIPOC counselors available. So those are resources to reach out to.
Right. The welfare office, Medicare may cover the services. So there are other options. Some people who work in different companies, sometimes their companies have a benefit. It's called EAP, Employee Assistance Program, and they offer counseling through them. So there are lots of other avenues. Donna, you wanted to add something?
Yeah, I think often when we're talking about free counseling, it really can depend on your insurance provider. And if you have one, there's Medicaid, there's Medicare. They both cover these mental health sessions, but it can be hard to find a counselor that will accept both of those insurances. Also, mostly there are providers under the hospital. We have the Deaf Wellness Center if you're in the area. Those are both really great resources, and they do have free counseling available for the deaf community for some people. In terms of BIPOC counselors, it's a good question. I think during our pandemic, you know, we're having now more access to remote counseling, to connecting each other through technology. So if you live in Rochester and you find a BIPOC counselor in New York City, now you're more likely than ever to connect with them. So that is one positive thing, a resource that can be utilized.
It's ironic that you're mentioning telehealth because that's actually the next question. The question is, telehealth, because of the pandemic, has become more popular and used. Do we expect that, hold on just a second, do we expect that individuals who are fluent in ASL will be able to find and match up through telehealth with a counselor? Is that more of a possibility now?
I think there are several counseling centers in the United States that do offer telehealth right now. For instance, the National Deaf Health, forgive me if I announce the wrong name. I believe it's the National Deaf Counseling Center.
The Deaf Counseling Center.
Okay, thank you. The Deaf Counseling Center in Washington, D.C. That's where they're based out of. There's another one that comes to mind. I can't remember the name. Can someone help me out? National Deaf Therapy, and that's also telehealth. We also have the Deaf Wellness Center. They provide telehealth. And, you know, how long will continue in terms of as things change with the pandemic, we can't say, but we hope that these resources will be available for folks in these situations where it helps even beyond the safety concerns of the pandemic. Again, a lot of it depends on insurance. Insurance may say, oh, you know, we no longer support telehealth because it's not required for the pandemic. We can't predict.
Right. There are insurances that are limiting the access for virtual services or telehealth. Yes. The next question, people are expecting that they're going to tell me what to do. My whole life hearing people have told me what to do. So sometimes it's a lack of education with a deaf individual, and the counselor will ask a leading question. This is all very much in English, so I'm trying to figure out what the question means. Can you see the questions, you guys? The expectation, tell me what to do in the deaf community. If you go up, it's question number 4. Virtual counseling. Oh, read question 4 instead. Okay, so if somebody is doing virtual counseling, or if because they find it difficult to travel to appointments, is it effective? Does it work just as well as it does having counseling in person, one-on-one? Is it as successful?
Well, I would say
Maybe it depends.
yes, I think it depends. I think it can be as effective, but I am noticing a real increase in everyone using telehealth versus people choosing in-person services. And I think in some ways it's more convenient to stay at home. Some people do have children rather than finding childcare, or you can't bring a child to your counseling session, whether there's elders around in the house to take care of those children or other resources, or maybe folks don't have easily accessible transportation. They might not have cars, the way I was speaking about earlier, or it might be, a 2 to 3 hour commute to get to and from those counseling sessions. So I am noticing an increase, not just because of the pandemic, but in remote patients because they find it easier. So that's one benefit. It's also comfortable for them. I think some people feel more comfortable expressing themselves in their familiar environment rather than coming to an office that they've never been to or that they're just not at home as much in. So whether it's a therapist or psychologist or psychiatrist, that sense of being at home, I think can be nice because I, as a provider, I'm seeing something a little bit different.
I see.
Yeah, and so sometimes there's good information we can work with, or I'll notice a strange behavior in someone because they're so comfortable, they're in their home, but I won't see that as much in the office. So that way it's easier to spot problems during telehealth, honestly, sometimes because I'm seeing these unusual behaviors because they're so comfortable.
I agree with what you're saying, Leanne. I think it depends. There are people that need that connection, that one-on-one, face-to-face speaking with someone, because that's where the bond happens. That's where the relationship is developed. But there are some people that would struggle with having to rely on virtual or telehealth.
I do imagine that video provision could save time. It could reduce missed time at work. It could reduce, some financial concerns. So it can be
The
more
travel and the time that needs to be taken.
yeah, and maybe less effective for others. So that's great. I think we have 15 minutes left. So let's just touch on the next question. The question is how to boost your mental health without going to see a counselor. Do you have other tips or suggestions for people to boost their mental health? I mean, self-care, maybe, perhaps managing people's thoughts. Can you talk about that?
Definitely self-care is part of it. Developing mindfulness, a more awareness of the way you think, the way you behave, how things affect you. Maybe reading a book that helps you with your own issues. A big part of what we're doing is, people are trying to figure out what to do. There are so many things that people are busy and they're trying to finish something. Maybe what we need is to have, a day to themselves, a day for self-care, a day to give themselves that time. For some people, actually many people, self-care for mental health is very difficult. You know, you can see it with another person. A counselor can see it in you. You can see it with someone else. But to know myself to do it, I'm just not aware of my own.
Do you have any thoughts, Leanne? Yes, I think that point of self-care also, we give it a negative stigma. Oh, I'm going to do something bad. You know, for instance, it's not just saying self-care because you abuse substances or drink too much alcohol or overuse medication. Those things are not self-care. Self-care means exercise. It means eating right. It means eating the right food, eating healthfully, eating when you're hungry, taking time to take deep breaths, taking time to meditate, just, you know, taking time to socialize with other people. That is considered self-care. So the idea of using bad voices, I want to be clear that that's an escape. That's not self-care. That leads to more disappointment, to more suffering. And, you know, that doesn't help the emotions that you're trying to actually soothe. It makes them worse in the long run, even though it's just temporary. So I just want to clarify, self-care are things that make you feel good in the moment, but also in the long run.
And maybe another good idea is for individuals to get in contact with their primary care physician or their medical provider and talk with them about that. And maybe get some tips from them that will match their individual needs. The next question. Oh, we lost it. So how can I help a friend or a family member who doesn't want to go to counseling or to get help? How can I help them to get that assistance?
This is a very difficult situation. There are people often who need counseling the most and don't want it, but you cannot force someone to receive mental health care. I think the best thing we can do is to be supportive. And I think what is also important for us to be aware of resources that are available. So when the time becomes ripe, you can provide that to the person without saying, oh, hold on, I need some time. I do want to help you. So that you can give them solid attention when they finally do turn to you, and you can lead them in the right direction. But really, the most important thing when you know someone who needs mental health care but will not accept it is to take care of yourself, to have healthy boundaries, to not get them out of dangerous situations to the detriment where you're providing so much care that it's not helping them or it's not helping you, but just to have those resources ready and be supportive until then while you're taking care of yourself.
The next question that we have is, how do I know when I should be asking for help? What are the symptoms? What should I be recognizing that it's a time that I need to ask for help? How do I know when I should be contacting a counselor? Leanne or Donna? Leanne?
Yeah, sure. I'll take this one. I think if you notice your motivation just declining, if you're realizing you don't want to go out, it takes a lot of energy to take a shower or a bath or to cook meals, and you're seeing that over time increasing to the point where you just don't want to get out of bed. You just would rather stay under the covers for days or weeks. When you're seeing that, that's a sure sign that you should be asking for help. If you're noticing you're crying for no reason, and that's happening consistently, if you're noticing that you're sad every day or easily angered on a regular basis, and that's happening over a course of time, those are signs to get help. Also, to know that if you're having a hard time keeping your train of thought, if you are forgetting things consistently, that's another time to get help. When you start to see these things happening, when you start to consider hurting yourself, self-harm, considering suicide, even just daydreaming about it, those are definitely times to get help without another moment's hesitation, so that you have someone there to listen, to provide source, to help, resources to help you during that time.
I think also when you are feeling maybe anxious, I think that I can just go put it past me and go, but it's not as easy. Maybe that's when you need help. If you're feeling that beginning of the anxiety, that beginning of not being able to manage, And
It's not
It's-
always about the symptoms you're experiencing, it's about the severity. So sometimes if you're feeling a little anxious and it passes, you don't have to worry about that. But as you're seeing it becomes more serious, so you have to understand a little bit of anxiety can be normal for those of us. But once you start to have these symptoms increase on a regular basis, that's when it's going to be harder to get yourself out of that struggle. So that's when you start to see the pattern.
and I also want to add, you have to understand that people think, oh, I'm going to a counselor because they're going to fix me. They're not there to fix you. You are there because it is helping you use your tools, using your assets, being able to improve your life, your quality of life. So it's not the counselor's job to fix you. We can't fix you. We're not in your shoes. We're not experiencing your life. We are there to help you utilize the tools. And we're not baby feeding or bottle feeding. We're allowing you to understand what you need.
Right. So counselors are guiding you to the right sources of support. That's a very good point. They're not going to just tell you answers to your questions. Okay, the next question. So this is people are saying, really, if I need an interpreter, is it much more difficult for me to get that mental health care? If someone needs a sign language interpreter, do you perceive that it will be a barrier for them in getting hooked up with a provider? I mean, maybe it depends on location as well, where folks are living. You know, some localities are more aware of the need to provide disability access, and some don't even know how to look for one, whether or not they know that it's their responsibility to provide one.
We at the Deaf Wellness Center provide interpreters. I have hearing families with deaf children or deaf adults with hearing children. So we are pretty good at bringing in interpreters when it's needed. We have no problem doing that. Other locations?
Yeah, this is very true. If you're in more of a rural area, it's definitely going to be more difficult. Now, during the pandemic, there's more telehealth. So for many folks through telehealth, it's hard to know how long that's going to go on for. It may be easier for those localities that know they have to provide interpreters, but don't have a lot to choose from to provide you with an interpreter over telehealth. But it can be difficult. And I think some providers and even patients have a hard time with having a third person in the room. So that can feel like a barrier for people. And during COVID, maybe it's less of an issue. You know, maybe people feel more.
During COVID, we've had the resources. So, and really, it's just also important to find the right interpreter for the client, for the counselor as well.
Yes, and not just that, but who is an interpreter who's aware of mental health, has training. There's a limited number of interpreters who are skilled for that field. So that's a real concern.
Yes, definitely. Leanne, you mentioned about children. How can parents help their children or their teens who may be having mental health problems? What is your advice?
I think the first thing is to remember to communicate as openly as you can, to destigmatize or even think about punishing a child for struggling with mental health issues. Perhaps they're misbehaving, but it's not their fault. You can't punish them. Often misbehavior is a result of an emotional response or a chemical response to something that they're going through. So to be clear that the parents are open-minded enough to understand that there's a lot of things involved, that it should be something they feel comfortable talking to a doctor, talking to a counselor. The parent's role is to really provide resources for the child and to make sure the child feels safe enough to go to the parent, to go to the doctor, to speak to other people. Because children really learn to cope with things during their childhood that will give them the skills to cope as they get older.
Yes, definitely. Communication is key. We have 5 minutes left. Oh, and it says this is the last question. So the question is, we're assuming It's a yes or no question.
So there's an assumption that hearing people are asked yes or no questions. And
Whereas deaf people are just told what they should do instead of figuring out what they want. Do you believe this is true? So between hearing and deaf individuals, do you believe that they receive the same mental health care? Is it equivalent when they are giving the care? Kind of in summary, we know that sometimes a deaf individual has spent their life just accepting a hearing person says, do this, do this, do this, do this. How do we make sure that the counseling sessions are being approached in a way that they're equitable to both the deaf and the hearing consumer?
I think it's hard to say because really, as a deaf woman myself, I'm not sure how hearing therapists handle their clients. We're all different. There are deaf cultural issues for sure. In deaf culture, we value being very direct, and it depends on what we've learned in our childhood, what parents have taught, what modeling we've seen in terms of coping skills or other skills. So what mode of teaching, whether you had deaf parents or hearing parents and how they communicated with you, there's a lot of variety. It may be very different depending on how culturally sensitive each of a deaf or a hearing counselor is.
And as well, I've noticed with a hearing family compared to a deaf family, the hearing family kind of sidesteps and is kind of oblique about things. A deaf family seems to be more direct. So with the hearing families, we talk about how to talk about those things that are being kind of passed over.
So it looks like we just have 2 minutes left. I think we will wrap up this conversation. So I don't believe we missed any questions. I just want to thank everyone. I want to thank our 2 presenters for just their valuable information and sharing their time. This is certainly a great benefit to the deaf community. I want to sincerely thank both of you. I want to thank the audience who's participated with your questions and just viewing and just signing in today. We also have more information about future Deaf Health Talks. You can sign up here at these links in the chat. There's monthly information, newsletters, and other opportunities to participate in the future. You can check the website. The address is right in the chat. Folks are saying that someone just made a comment that said, fantastic, thank you. So we're getting some good feedback. There's another comment saying, thank you so much for your efforts to support this. But if you're interested and you'd like to make donations for the future, we're open to accepting donations so we can continue to provide these kinds of helpful informational talks to the deaf community. So please, there's a link there if you'd like to donate. And also, if something strikes you that there's a hot topic, something that you'd like to see a Deaf Health Talk about, please send us an email. Please give us suggestions, and perhaps we can specifically provide a talk to address those interests. And that email would be deafhealthtalks@gmail.com with your ideas for future talks. But I want to thank everyone. I want to thank you for your time. Thank you for presenters. Thank you for listening, the audience. I think we're finishing perfectly on time at 9 p.m. So that's fantastic. Thank you so much, everyone. Have a wonderful night. Bye-bye.